with another 335 COVID-19 cases announced today. BC's number of new COVID-19 cases remains high. And with this steady increase, could protocols soon be changing?
Joining us live to answer your COVID-19 related questions is BC's Deputy Provincial Health Officer, Dr. Réka Gustafson. Good evening, and thanks so much for joining us tonight. So, considering the bulk of the cases continue to be in the Fraser Health region, do you believe regional restrictions are effective and should come in place? Dr. Gustafson, can you hear us?
Well, we seem to be having trouble with our connection, at least the audio connection with Dr. Gustafson. Can you hear us now, Doctor?
Yes, I can.
Oh, very good. Tina has a question for you.
Yeah, so considering the bulk of the cases are coming out of the Fraser Health region, do you believe regional restrictions are effective, and is it time to bring those in place?
So certainly one of the tools we have in our toolbox is regionally specific interventions that address the specific modes of transmission. So this is something that I think is absolutely something that we need to consider and start implementing in this phase of the pandemic. Early on in the pandemic, we had very broad measures as we were learning about the virus, but now that we have good local data and good information about where transmission is occurring, we need to make sure that we balance both the benefits and the risks associated with restrictions, so making them as targeted as possible is actually one of our tools.
And a viewer, Dr. Gustafson, wants to know what that might look like, asking about a color-coded system for risk. We talked about that. Ontario is doing that. We talked about that earlier in the newscast. Is that one way, the color coding, to determine risk in specific areas?
Color coding is one way to do it. It's a good way to communicate the number of indicators that we use in order to determine what the risk is. We haven't to date color coded it. We may do that we are certainly considering that right now. What we're doing right now is providing a dashboard day to day that gives a snapshot of all the indicators that would go into a color coding.
And Christy on Twitter asks, with the Chilliwack outbreak, we're seeing it taking, up to 6 days after a test for contact tracing to begin. So, a lot of talk has been about this app. Would it be helpful to have the app so people could be notified sooner of a potential exposure?
If you're referring to the federal app, we actually did consider the federal app quite carefully in British Columbia. And given this current functionality, we really didn't think it was adding additional benefit for BC right now. What we are doing, however, is using a variety of modalities to give people their test results. So we're automating the provision of the test results, which is something that we have already done to an extent and are going to continue to expand so that there is no delay to that notification of the test result.
Okay, Amy has emailed tonight Dr. Gustafson to ask, or to say, I know there are many conspiracy theories floating around about COVID in the U.S. We're now seeing them gain a bit more traction in Canada. What's BC doing to try to combat that online and perhaps in person?
So actually the conspiracy theories in British Columbia, if they have occurred, they haven't been a dominant narrative in British Columbia. I think we've actually had a very constructive public debate by and large in BC, considering how this pandemic is affecting us today. So that's not, there have been many things that we've addressed through our media, through our Twitter, through our information, but conspiracy theories haven't been really a really important source of misinformation in BC.
Dr. Gustafson, there is a lot of talk about this BC COVID tracker. A lot of people are speaking about it on Facebook, that actually has more information than on the actual BC CDC or the health region's websites. How can we close the gap between what's out there on social media with parents posting to that and what's out there on the health authority's website?
Well, that's a really good point. One of the things that we do know is that the moment somebody gets a positive test, they can put that on social media, and there is an ability to share that very, very widely. I think in this particular case, now that we're in the 11th month of this pandemic, immediate information that may or may not be accurate is not as important as information that is accurate. So I would say that probably almost no reporting system will be as fast as social media, but I would make sure that that people actually refer to the BC CDC website where information has been validated and provided in a consistent fashion. That's what I'm trying to get at. So I think social media actually can have some value, but it also is often a way of sharing information that may not be valid, may not be entirely accurate, and could potentially lead people to take take actions that weren't necessary.
Okay, Dr. Gustafson, we know your colleague, Dr. Tam, at the federal level has updated the regulations, or the guidelines, I should say, on wearing of masks. Here's a question from Chris on Twitter. Curious to know if masks help prevent me from infecting someone else or vice versa. Why are we not making them mandatory in BC?
That's a really common question, and I think it's important for us to remember that masks are in fact recommended in British Columbia according to the Public Health Agency guidelines, which is that public health recommends based on local transmission. Mandating a mask, making it mandatory, the additional benefit of mandating something is actually very, very marginal, but can actually be stigmatizing for individuals. Saying something is mandatory implies that I will deny you service, that service that may be essential to you. It may lead to stigma for people who aren't able to wear a mask. So I think the important thing isn't that it becomes mandated. The important thing is that we make recommendations based on our local epidemiology, our local transmission that's consistent with the evidence as it comes out, and we support and encourage people to do so. And we're doing that with as clear information as we can. I think we certainly feel in British Columbia that the additional benefit of mandating something that is still remains quite low, sort of low on the hierarchy of infection control, would not be a proportionate response to that benefit.
And AJ called to ask, what about temples, religious institutions that are still allowing people to gather? What kind of actions are health officials taking to ensure that they're safe?
That's a really good question, and I'm actually glad you're mentioning those. One of the things we are learning since the beginning of the pandemic is the number of ways that we can gather safely. So what we are doing, there's two things that we do, and we are doing it throughout the province. We are working with organizations to make sure that their gatherings are safe. They are limited to a certain number, and infection prevention and control precautions are taken into are implemented. And we are actually learning that some of the basic interventions that we have been talking about, which is washing your hands, staying home when you're sick, keeping a physical distance, using a mask if you're not able to keep a physical distance, and keeping your group small and consistent, are actually effective ways of preventing infection. Obviously, if there's a gathering or there's a venue that isn't adhering to those kinds of prevention methods, then we have environmental health officer and public health who can make sure that they respond to that.
Okay, let's sneak in a couple of questions quickly while we've got some time. Tracy just called in a few minutes ago to ask, should BC consider, we talked about regional restrictions, but should BC consider a bubble like the Atlantic provinces, like for the whole province?
Well, I think the Atlantic provinces are in a very different situation than British Columbia. And we have to keep in mind that that would be a restriction that would have enormous impact on families, on businesses, on our economy. And as we're learning to live with pandemic, our key word is balance. We have to take interventions that we know are effective for our province and balance them with the unintended indirect consequences that may be affecting our wellness in other ways. So creating a bubble like that is not an intervention that we're considering. Certainly we've put border restrictions in place. And we are actually finding that individuals who are coming to British Columbia who may be infected with COVID-19 are not a major driver of transmission in BC. The major driver of transmission in BC is local transmission,
And
which is different in the Atlantic provinces.
And we've got time for a very quick question. Just a quick update on the flu vaccine. I know Surrey and Fraser Health were looking to order some more. Where are we standing there?
So we are actually ordering more influenza vaccine and providing it to all providers, including pharmacists and physicians and public health units. So yes, there has been a significant demand for influenza vaccine this year, and it's an early demand, and we have ordered further supplies of influenza vaccine to meet that demand.
We need to get you back on our newscast soon because we got all kinds of questions that we didn't have time to get to. But Dr. Gustafson, thanks very much for doing this tonight. We really appreciate it.
My pleasure. Bye-bye.